So I'm here today to talk about the Modified Thomas test. This is a very effective and useful assessment for trainers and physical therapists alike. Now, what's really useful about this assessment is it actually looks at three potential dysfunctions. We're looking for excess stiffness of the iliacus and psoas, which just crosses the hip joint here. It will also assess excessive stiffness of the rectus femoris, which is a long muscle that crosses the hip and crosses the knee joint. And it can also identify excessive stiffness in the tensor fasciae lata, or the TFL, which crosses the hip joint right on this outside lateral portion. So I'm happy to have my friend Dr. Tricia Smith here to assist us. So like any good assessment, the key point is that you do it correctly. And this is no exception. So the first thing that you're gonna have your client do, if you're assessing the right side for excessive stiffness, is lay back here on the edge of the table, pull the knees to the chest. Now you'll see that she's resting her head on a pillow. It's very important that the head and neck are relaxed so you don't get excessive tension up there. Now from here, what she'll do is she'll grasp her right under her left knee with both hands. And then from here, it's going to slowly lower this leg down. Now the most important component of this test is that the lumbar spine or the low back stays flat. Okay? Because if you just let someone just drop their leg and this lumbar spine extends, then that means the pelvis is rotating, and that will give you a false negative. So be sure the lumbar spine, low back region stays flat in its neutral position. Then from here, you're gonna let the leg go down slowly, keeping that low back flat, and we're looking for three different things here. First of all, the knee joint should be about 100 degrees or less. You can take a goniometer and measure that, or you could take a photo and use one of the apps to measure the angle. You'll measure from the center of the knee joint to the greater trochanter, which is here, and then down to the lateral malleolus. Now, this is an indicator of rectus femoris stiffness. So if her knee was greater than 100 degrees, then we're pretty sure that the rectus femoris has excess stiffness. The other thing we're going to look at here is, does the thigh become parallel with the table or rest on the table? If the thigh were up here, then that's a good indication that the iliacus and psoas probably has excessive stiffness. But a stiff rectus femoris can also do this. So what you have to do to differentiate between the two is you straighten the leg. This shortens the rectus femoris, so now it won't be a limiting factor, and see if the leg goes down more. If it does go down more, then that means that the rectus femoris is stiff. If it doesn't go down more, then that means the iliacus and psoas is stiff. So the last thing you're going to look at here is the alignment of the thigh in relation to the trunk. The thigh, you should be able to make a straight line between the outer thigh and the side of the trunk. If her hip is abducted, then it means that the TFL has excessive stiffness, because the TFL is actually a hip abductor. So when it's too stiff, it's too short, it will pull the leg out to the side. Okay, you can just sit up here, Tricia. So a couple more things here. We've looked at the TFL for excessive stiffness, the rectus femoris, and the iliacus and psoas. Now, some of the more progressive trainers or therapists might go beyond simply stretching those muscles. Stiffness in the hip flexors can be caused by abdominals that are too weak, so you might want to do some abdominal activation exercises, see how that changes the Modified Thomas test. The TFL can hold excessive stiffness when the glutes, the glute medius, glute maximus as well, when it's weak in the frontal and the transverse planes. When they're weak there, then the TFL will hold excessive stiffness. So you could do some glute activation drills in the frontal plane and then retest that assessment and see if that helps. But the modified Thomas test is an excellent way to determine if there is excessive stiffness, and the main thing is be sure that the low back stays flat, because research is very clear. If you don't control the pelvis, then you're probably going to get a false negative. So I hope this helps.